This video is going to discuss the 7 pillars of health and healing, which is part of our customized clinical nutrition program. The 7 pillars of health and healing were developed by my mentor over the last 30 years and 30,000 patients. The basic concept is that there's a genetic physiological genius of our body. There is the way that God has made our body to work and operate. And then there is these pillars of health, these pillars that can hold us up to get to homeostasis, which is balance in our body for our foundation of true health. And this then can create your health and healing potential, you becoming fully alive. The first pillar of health here that you can see in the center is the endocrine system, also known as the neurohormonal system, which deals with the nerves and the hormones, which control and coordinate your entire body. The first pillar of health listed here on the side here is the neurohormonal system or endocrine system. The first thing that we want to do is work with systemic activation of healing and repair. We do that by using something called protomorphogens. Protomorphogens, or PMGs for short, are actually specific mineral extracts that we can use to upregulate the function of your glands for them to start to repair themselves and get younger again, like when you were young, when they were vital. Okay, so we want to increase the vitality in each one of your glands and your organs of your body. Then what we use is the second step to work on the endocrine neurohormonal system is liver support. The liver, when it gets toxic, can actually build up and block your body's ability to control and balance any excess hormones that are going in your body. So we work on that as well. The third step is lifestyle modification and looking at the things that may be creating more stress in your life, etc. And the fourth step is herbal support. So we'll use specific herbal supports targeted at bringing up the energy and bringing up the vitality of those organs. The last step is hormone replacement therapy. And we find that most people don't need to go to hormone replacement therapy because we get results with these other steps by feeding the system or feeding the organs and the glands back what they need to be fully alive. The second pillar of health, which you see here, is called the glycemic management pillar. Glycemic management talks about blood sugar balancing. You've probably heard a lot about blood sugar balancing. But one of the things that can happen to us is that our blood sugars can come up, and then our body has to respond with something called insulin, and then the blood sugar comes down. If we're doing this over and over again, we have this kind of roller coaster type experience in our life where our blood sugars are up and then they're down, and they're up and they're down. And so what we want to do is we want to reduce the insulin responses to the blood sugar being up, and also reduce the cortisol responses, which is a stress hormone that responds to the fact that your body is going up and down with the insulin. And how we do that, we actually resolve food cravings with protein and fat, and we remove starches from the diet. Starches are thousands and thousands of sugars, and they can actually create this roller coaster ride for us. So we start removing the starches, putting protein in 3 times a day, resolving the food cravings with that, and we see a lot of balance with that. We also use the whole food nutritional supplements that are listed here to help balance the pancreas, or to actually work with, like it says, AF beta food is enhancing utilization of glycogen, and this helps us get a more balanced state here. The next pillar of health is the bioterrain pillar. The bioterrain pillar is working with minerals. Minerals are what helps buffer an acid environment. We live in an acid world. Environmentally, even fluorescent lights make us a little bit of acidic, and the foods that we eat often make us acidic. And if we cannot buffer the excess acids that we have in our environment, then we create a situation of acidosis, and this increases anxiety, it increases inflammation, it increases intensity of situations that you're experiencing. Have you ever felt like you've reacted more than you really needed to? That may be because you're in an acidic state. Okay, we can easily tell how you're doing in the acid or alkaline by doing pH, which is using pH strips, and you can do a urine strip, or you can actually do saliva as well. And we want to make sure that we're balancing the different minerals. There are many minerals. You've probably heard of calcium and magnesium, but there are many minerals to make sure that they are balanced in your body. The fourth pillar of health here is called the inflammatory pillar. Okay? The inflammatory pillar works with inflammation. Inflammation is cumulative repair deficit, the inability of your body to repair itself. Okay? Cytokines, or cell hormones, they actually drive the adrenal inflammatory levels. Okay? Inflammation creates a fight or flight defense physiology. Okay? This increases cortisol, again, a stress hormone, which then fatigues the adrenals once again. The primary way we bring down inflammation is actually by figuring out what your core food allergen is. Most of us have one or two core food allergens that make other situations with food worse and creates much more inflammation in your body and your blood vessels and can lead to lots of other trouble. And so we figure out what your core food allergen is, and then you do an elimination test and you find out if that's true for you, and if it is, then we remove that and we can see results in bringing down the inflammation. Now we don't do that until around month 4 of the program, so don't have to worry, okay? The next pillar of health here is the immune system, and that's the 5th pillar of health. And the immune system, of course, battles infections, but it also works with infestations. We sometimes have cavitated infections, infestations in our body, and we even have heavy metal toxicity that can build up in our system, and it constantly upregulates your immune system and congests the lymph system, and the lymph system is sort of the sewage system of our body, congests that system, and then it fatigues the adrenals once again. You hear the adrenals get fatigued from a lot of situations, and then also fatigues the bone marrow, which is where we make our white blood cells, etc. So what we do to work on the immune system is we use sequential immune upregulation. Sequential immune upregulation means we give you a supplement that's going to boost your immune system, okay? And then you'll be on that supplement for a month or two at a therapeutic dose, and then we switch to another immune supplement to strengthen your immune system from another targeted way, from another vector coming in to help upregulate that immune system. And your body just is able to kick out these old infections, infestations. A lot of them stay up underneath our teeth, etc., and we're able to get this stuff out of our body. The next pillar of health is the circulatory system. The circulatory pillar is the 6th pillar of health here, and as you know, circulatory system determines tissue nutrition, okay? So your circulatory system, your blood system actually gets nutrition to your tissues, to your organs, to your body, all over, okay? And also detoxification, because if we want to pull these things out of our tissues, it goes through our blood system and lymph system, okay? It is one of the two of the primary etiologies of disease. The other one, of course, is the inflammatory pillar, okay? So inflammation and circulatory pillar are two of the primary etiologies of degenerative disease. And what do we do for the circulatory system? Well, we start feeding the heart and feeding the blood vessels what they need to start to restore themselves to their health and healing. We've just seen some amazing results of what's possible of being able to restore the function to these areas. And the 7th pillar of health is digestive potency. The 7th pillar of health works with the body being able to bring in the substances and sustenances that your body needs to be healthy, and also to remove the waste. Okay? Interesting enough is 80% of your immune system resides in the gut-associated lymphoid tissue, in your gut, in your GI tract. It's 80% of your immune system. So that comes back to over here. We want to always work on strengthening the GI tract whenever we see there's an issue going on in the immune system. Okay? Loss of gut ecology, the balance of your good and bad bacteria in your gut, can also increase inflammation, immune modulation, can create auto-intoxication, and can create tissue degradation and leaky gut syndrome. Okay? So we can have a lot of things going on that can just be out of balance just because the good and bad bacteria got out of balance in your gut, which can happen from the foods you're eating, drinking chlorine water, if you've taken antibiotics. All these things can create an imbalanced state there. And then loss of digestive potency results in famine in the midst of plenty. You may be eating plenty of food, but not getting the nutrition into your tissues that your body needs. Desired bowel transit time is about 12 to 14 hours, which means if you eat a red beet, it should come out red the other end within 12 to 14 hours. And we just continue to work on building the gut lining here, because gut lining is the armor to your world. So we strengthen it with fiber and nutrients and all these other things that help strengthen that gut lining. So these 7 pillars of health, they take about 6 to 9 months to get through all the 7 pillars. Now, of course, you can start and stop the program whenever you want, but most of my patients choose to come in and follow our program where we meet once a month. We do a detailed history, and then we do our system strength analysis, which we'll talk about in another video, but it's a form of biofeedback. And we use those two things, the intellectual and intuitive, to come together, and we follow up once a month and watch the progress as it happens. At the end of that time, we go into maintenance, and we may see each other once every 3 to 6 months, depending on the situation. Look forward to the next video, which is called System Strength Analysis.